Another idea would be perhaps an ICU, what they call a critical care interventionist. They could be of great help. And then there's a new invention. You guys are probably used to seeing our physicians walk around with a stethoscope. Well, now there's the V-scan from GE, and that's a wonderful new ultrasound that can help the physician a great deal. And when we can interface that with the technology of the iPhone, so that the physician can know the patient is reaching crisis, perhaps in the labor and delivery room. They can be ready. They can call from home and say, "Look, I'm looking at these numbers on the monitor. Get the patient ready for a cesarean section, whatever." So there are many things that could be done along that line that may help the hospital bring down some cost, even though there may be some early cost involved. Michigan is become involved with minimizing hospital infections, and hospital infections are a plague across the United States. Our hospital is doing very, very well in that regard. Health and Human Services has called for a 50% reduction in bloodstream infections caused by the IVs, and simple things, just a very simple checklist instituted can help the hospital a lot, reduce those in taking out the IVs at an early stage. So I'm saying I'm full of ideas. I want to help. I'd like to be a part of the community. Please vote for me. I'm Larry Lanham, and I'll be your candidate on the board. Thank you.
Thank you, Larry. All right, number 4, that's you, Tim. Okay.
Thank you, Donnie. My name is Tim Kelty, and since most people after perhaps 65, they need glasses and obviously need notes, so I'm going to give you some tonight. I've had the privilege of serving the citizens of Hopkins County in the capacity of board member of the Sulphur Springs of the Hopkins County Memorial Hospital District for the past 9 years. I've also had the opportunity to serve as secretary, vice president, and president of this institution. When I began my service 9 years ago, our hospital district was in the need of establishing a better image in our community. I can remember many monthly meetings that we would receive complaints, accusations, and other derogatory remarks about all facets of our hospital. But today I can assure you that the letters that we receive are much more complimentary about the outstanding service that our hospital is giving to our community. Our new bedroom tower and ER facility is on the prime edge of cutting edge of the commitment that we have in our community. Our new heart cath lab is on the cutting edge of technology and performance, and is staffed with qualified health professionals. Many people do not know that Dr. Jeff Gladden, who is the president of Advanced Heart Care and in charge of our heart care lab, is the same gentleman who is one of the 2 partners in Baylor Plano Heart Hospital. He is here on probably 2 to 3 days each week, and of course we provide services for five days a week for our heart hospital. Our 3-story medical office facility is first class in every way, built to serve the needs of our citizens and our community. Our inpatient and outpatient facilities, as well as our wound care center, receive numerous awards on a yearly basis. In the past 9 years, we have recruited family physicians, PAs, orthopedists, obstetricians, neurologists, pediatricians, surgeons, EMTs, urologists, and now we even have a vascular surgeon. As a matter of fact, I believe in the February meeting, we had performed 2 operations that had never been performed in our hospital by our vascular surgeon, and in both cases, everything turned out quite well. You know, we've been in a situation, I was thinking that I saw, some of you may have seen it, that there was an article in the paper. I guess it was about 2 or 3 weeks ago, if I remember right, that you saw a list of all the doctors that are serving in our hospital. And I did a little math, and there's approximately 32 doctors that are on this sheet. 16 of those doctors have been here, have come in the last 9 years. Obviously, we have services that we have been able to perform in our hospital that has never been here before. And when I say never been here before, we've had people who have come in and performed services and then left our community, but we've never had those people living here in our own community. I guess that one of the things that we talked about last night in our board meeting is that we were reviewing our administrator for his job evaluation. We're talking about a lot of things that have gone on, and we in the comments that we made among ourselves, that I think that we all agreed that probably this past year has probably been the most tasking year that we have ever had in a long, long time. We've just finished a multi-million-dollar completion of building our new ER, our new three-room bed tower, and then after we get into it, what happens? NOAA pulls on the front block, and we have a flood. And so then we have to start all over. And there has been so many things that basically have gone on in our hospital district over the last year that has been monumental. But it's just part of the times, and of course we haven't even talked about, as our good dentist friend talked a little bit about, the economic times that we have right now. And you know, when you build a facility like we've built for our community, you think, well, things that people are going to come. Well, that was true, except for one thing: the economic times changed, and surprisingly, people don't come in economic times. And if you look all over the nation, it's the same way everywhere. You know, as I say, this capacity in relationship to trying to be, and Joe can testify, he's been on the board probably 3 months, if I remember right. The multitude of things that actually occur that for all practical purposes that we have no control over. In many, many cases, we have no control over it. Yes, we have a lot of control over a lot of things. And one thing that did occur this year that probably was the most tasking thing that we've had in a long time, and that is we had a tax increase. Now, anytime you have a tax increase, it doesn't make any difference if you hadn't had a tax increase in 20 years. We talk about what's going on right now. But surprisingly, if the citizens of this community realize that because of the past, our past board, our past administration, our past things that have gone on, we were able to build this hospital through, and a lot of that money that was spent was money that we had saved up over a period of time, or we could not have possibly built it. As a matter of fact, if we had that same situation today, there would be no way that we could possibly be able to build the hospital but didn't have capacity. But I'd like to say that I would like to thank you for my service in the past 9 years, and if you feel like that I need to be back up here one more time, then I'll try my best to do that if I possibly can. Thank you very much.
Thank you, Tim.
I'm like, was it you, Bill? Too many years for the glasses here. Got too many things going on. Also, I would like to thank all of you for coming, the Republican Party, for Donnie for arranging this, and Beth, I'm sure did too. I'm Suzanne Thomas Bankston, and I'm a candidate for the Hopkins County Memorial Hospital District Board. I was born in Sulphur Springs, Hopkins County. Dr. Bird was My doctor, and if we saw specialists back then, we saw Dr. Steve and Dr. Joe. My parents were Frida and Wilson Thomas. I've been a member of the First Presbyterian Church for over 50 years, meaning I think they do miracles down on College Street because I'm not that old, right? I'm married to Bobby Bengston, owner of Bengston Memorial Monuments and Caskets, and I am a professor of special education at the University of Texas at Tyler, and I'll be joining the faculty of Texas A&M Commerce in the fall, coming home, yay. I want to take my few minutes to tell you 3 things that I stand for and reasons that I was interested in running for the board. First of all, I've already told you I've got Hopkins County blood running through me. I was born, reared here. Both my mother and father's family have lived here for generations. So I am a Hopkins County person, and as Larry says, it's a great place to live. I really have seen the need personally, from a personal standpoint, myself, my family, my husband, of having good quality medical care here. And I've seen all the ravages when you have to go to Tyler or Dallas or someplace else. Travel, be out of your element, out of your comfort zone. Your family has to travel. I know the importance of having that care here, as the song says, right here in River City. The second thing I want to say to you is that I am a fiscal conservative, and we have heard about some of the financial issues at the hospital. What I mean by being a fiscal conservative is I was taught as I came up to squeeze every penny as tightly as you could squeeze it, especially when it's not your penny. When it is your penny, it's the pennies that belong to the taxpayers. As a fiscal conservative, I think every decision must be made based on what is your goal, what is your mission, what are your core values. And the third thing I want to tell you is my number one. It's my core value. Every decision should revolve around patient care. Patient care is the number one priority. As the founder of the Mayo Clinic said, something like, if you make every decision based on patient care, that should be your only concern. And everything else then falls into place. Am I qualified to be a member of the board? I think I am very qualified. I have graduated from East Texas State University back before it was at A&M Commerce. I have 2 master's degrees from the University of North Texas, a degree in special education, and a Master of Business Administration degree, an MBA. I have a doctoral degree, a PhD from the University of Florida in special ed administration. The 2 degrees I mentioned last, the administration part, says that I have had graduate coursework over and over and over in management, marketing, personnel, finance, accounting. I have taught those classes, and I have lived them as an administrator of healthcare facilities for people with the most severe cognitive impairments, the most severe forms of mental retardation. If you don't know, most all of those people have also have severe medical needs, meaning I have worked hand in hand for 30 years with doctors, psychiatrists, nurses, nurse practitioners, all of the therapists, whatever flavor, occupational, physical therapists, speech therapists, rehab counselors, rehab rehab engineers, those people who are responsible for the improvements we've seen in care for people with disabilities because of advances in technology. I have the passion. I have the care for all the people of Hopkins County. I have the physical restraint, conservative background. I have the education, and I have the experience. And I will be your voice. I will listen to your needs. I will convey those as a working member of the board, and I appreciate your support. Thank you.